You have no idea what you're talking about. Second point is, Canadians wait the longest time in OECD countries for approval of medications, which you clearly have no clue about. We're back to that again. Sadly, the last time you were here, you had no clue, and you remain clueless, obviously.
Welcome to Serve News.
As parliamentarians and seek solutions to the difficult issues that are in front of us, we can find solutions. And I want to also thank the Now Health critic and member for Burnaby South, who is the House Leader, who I've had a chance to work with, both as a House Leader and as a Health Minister in his different roles on this, and thank him for his work. And of course, within our own caucus, the member for Brampton South, who is really been extraordinary in her advocacy. And of course, there's so many, I could use the full 5 minutes. But I'm going to focus today on drugs. We can talk about all the things that we're doing on health, but let's talk specifically about medication. You know, there's 1.1 million Canadians who aren't insured. And about 1 in 5 who are underinsured. In a very practical sense, that means they don't have access to medicine they need. Now, today in question period, Mr. Chair, we were talking about your home province of PEI and the difference it makes for the folks, for Islanders, to be able to afford their medication, and how critical that is, not just as a function of affordability, but really as a matter of dignity and a matter of prevention. If somebody doesn't, and let's just take diabetes in the first example, and some folks ask why diabetes. This is so fundamental to stopping so many other chronic diseases and illness. Do you know about 70% of chronic disease and illness are preventable? So we're taking historic action to deal with the crisis of the now in primary care and making sure people have access to the doctor and nurses that they need, that making sure that we're upstream so that somebody doesn't get sick in the first place is so critically important. When somebody has access to the diabetes medication they need, what does that mean? It means that they don't wind up with heart disease or a stroke. They don't wind up with a loss of a limb or dying. That's fundamentally important as a matter of social justice. It also is fundamentally important as a matter of savings. So we know that about 25% of folks with diabetes right now saying that cost is a major factor for them in sticking to a regime where they take the medication that they need. So you could focus on problems and critiques, or you can focus on solutions. That's what this bill does. It says, let's work with provinces and territories on creating a baseline. So when we're looking at that formulary, that's a minimum. It's not a maximum. Let's be very clear that everything that we're doing here is additive. It's working with provinces, that nobody's going to lose coverage. This is all about expanding coverage and making sure that patients have choice and that they get the medication that they need. And let's talk about sexual health for a second as well. We need to have a conversation in this country around sexual and reproductive health. To be able to say that every woman in every part of this country has the ability to choose the reproductive medicines that they need to take control of their reproductive and sexual health and futures. And to me, that is fundamental, and I hope sparks a general conversation about sexual health in this country and about sex being something that is affirming, that makes you grow stronger, and not something that is used as a tool for shame and pain and hurt. I look at this plan, and I want to say there are people who say, well, it's too much to hope for. You know, I was saying that today in the House. Don't hope for dental care. Don't hope for Pharmacare. You just give up. Go away. Well, they said that about dental care. In 3 weeks, yesterday at noon, we crossed 100,000 seniors getting dental care. And to put that in perspective, when I was in Vanier talking to a denturist, about a patient for 41 years had the same set of dentures. Next week, she's going to be getting a new pair of dentures for the first time. That means she isn't crushing food in her mouth with plastic plates. She's going to be afforded the dignity of teeth in her mouth. This is real stuff we're doing. And there are people right now waiting for the contraceptives they need for their sexual and reproductive health. They're waiting for the diabetes medication that they need. Talking to Sarah in a clinic here, in a diabetes clinic, about what that's going to mean for people avoiding illness, for seeing patients who are reusing syringes and getting blood-borne diseases because they don't have access to it. This opens the door for us to negotiate with provinces to make sure that everybody gets that coverage. It's going to have a huge impact in terms of dignity, social justice, prevention, and cost avoidance, and I am exceptionally excited to talk about it today. Thank you, Mr. Chair.
Thank you, Minister. We're now going to begin rounds of questions, starting with the Conservatives for 6 minutes. Dr. Ellis.
Thank you very much, Chair. Thanks, Minister, for being here. You know, you talked about access to primary care. Can you tell the committee how many Canadians do not have access to primary care?
It's high. It's, of course, regionally dependent, but far too many Canadians don't, and that's why we're working on these agreements.
Across the country, Minister, how many Canadians don't have access to primary care? You know the number.
Well, it varies, and sometimes it's difficult to know, actually, because the circumstances are too opaque. We're missing a lot of the data that we need in health to be able to give precise numbers. So they're best guesses, but the number is too high, and I've seen a lot of numbers all over the map.
Minister, you're too afraid to say the number because under your watch it continues to increase. Is that not true?
Well, no, actually, under the last 10 months, we've made huge progress. On my watch as health minister, we've signed 26 agreements, moving forward with $200 billion in funding. And I think you wouldn't find an association or an organization that represents nurses, doctors, personal support workers who isn't saying we're making tremendous progress and have over the last year.
Well, it's interesting, though, Ministers, because you've refused to give a number, but now you're telling Canadians that you've made progress. If you can't even count the number of people, how can you tell that you've made progress?
One of the things that we did in the agreement that I think is critically important is put common indicators across the country and prioritize health data so that we don't have that level of opaque nature to our health system. I think that we have provincial and territorial governments. It's essential that we have common indicators so that we can have clear and concise answers to these questions. So that was one of the things we built into that.
Let's just give a number. How many Canadians do not have access to primary care? Just a number. How many million?
Too many. We don't know the number.
That's not a number.
Well, we don't know the number. I've tried to explain that we can't. It's an unknowable number because.
Minister, except you.
Well, if you know the number, then say it. And where does it come from? Can you cite the source?
Thanks very much. Maybe I'll try one of your associates here. Mr. McDonald, do you know how many Canadians don't have access to primary care?
Per the minister's comments, I mean that's information that's being collected pursuant to the agreements that have been signed.
So here we are. We have, and maybe Madame Boudreau, could I ask you the same question? How many Canadians don't have access to primary care?
Thank you for your question, Mr. Chair. I wouldn't be able to add anything further.
So what you're telling me is we have 3 officials, including the Minister of Health, who have no idea how many Canadians don't have access to primary care. Wow. This is going to go a long ways to helping Canadians then. How about this, Minister? Semaglutide. Why is it not on your list of medications?
Well, what we did is create a base. So one of the things when we're negotiating with provinces is to say this is just a floor to make sure that we have for those who are uninsured or underinsured, that we have a floor. So, we're absolutely open to both the committee's comments and negotiations with provinces to be additive. I would say that the list that you see is an absolute minimum, and I would expect there will be no final list that doesn't include more. So if there's things you think should be on that list, I'm actually quite interested in having that conversation. Hopefully it would mean you support the legislation.
Yeah, I don't think we need to worry about that because it's bad legislation. It's bad for Canadians. Can you tell Canadians how long it takes in Canada on general from first launch to public reimbursement for a medication?
Well, again, varies by province, but again, I would take it back. I hope that you won't just summarily reject the idea of helping people who are uninsured get medicine. I would ask you, if
Minister,
not this plan, what is your plan,
question.
sir? So there's
I think that my
1.1
question,
million
Chair,
uninsured Canadians.
I believe,
could you tell us what your
Minister,
plan is to insure
question,
those folks? To make sure that people who don't have medication have medication.
You'll
what
have
is
your
plan,
chance to
sir?
ask me questions at some point when you're sitting in the opposition. But can you tell all Canadians the number of days from global first launch to public reimbursement? How many days in Canada?
Again, when you're talking, depends on the medication, depends on the jurisdiction. But I would put it back to you. If you were going to vote against something, my preposition would be that you have to explain what you're going to do in its place. So if you have all of these folks who have no insurance and no medication, it's a pretty simple question to ask back, what are you going to do in its place? And you say you have no answer, then I would say, why are you voting against this?
No, I didn't say I didn't have an answer. You're the person who's given me, I've asked you 2 questions now, simple numbers, which you do not know the answer, nor do your officials. Third question, simple number, let's try another one. Percentage of new medications available by OECD country, 460 new medicines launched from 2012 to the end of 2021. How many are approved in Canada? What percentage? Just the percent. Just
Yeah, I'll just be straight with you. This is like, what is your purpose? Like, what are you trying to ask? Like, I understand you're trying to play a gotcha game here instead of, I'm trying to talk about people who don't have medicine, and you seem to be lost in some kind of partisan, like, weird thing that you're doing. Like, do you have a plan for people to get medicine, or do you not?
Minister,
and is this an attempt to obfuscate the point that you don't have a plan?
You're trying to do, we can talk about those. But what we're asking is simple questions on behalf of Canadians when we know.
No, I'm just curious. What's your point? Do you have a point?
I have lots of points. Well, let's start with the first point. You have no idea what you're talking about. Second point is Canadians wait the longest time in OECD countries for approval of medications, which you clearly have no clue about. We're back to that again. Sadly, the last time you were here, you had no clue, and you remain clueless, obviously. The percentage of new medications available in Canada, 44% of 460 medications. What that means is despite the fact that you want to go out and announce things that are untrue and not even happening, the system that you have, the regulatory system that you, sir, have control over, is failing Canadians. You had an opportunity to change that. You have chosen not to. You have chosen to attempt to keep yourself in power with your NDP costly coalition partners by creating something that already exists at provincial levels.
That's your time.
Thank you very much, Chair.
Comment, like, and subscribe. And join if you can.